Thank you so much for being here today, Joy. I really, really appreciate it.
Okay, good. My pleasure. Anytime I can educate anyone about my passion.
I love it. I love it. And for those that don't know about you, I'll make sure to include your full bio in the show notes. And, I've heard about you for quite some time now, and I finally got to hear you speak a few months ago at an event with your son, Mark. So for people that don't know about you and your story, I'd like to start there and just talk a little bit about your journey with your son Brian and how that's developed into this passion that has now been your career.
Well, it started in 1980. Actually, in 1978, I was a dental hygienist. I had been teaching at Indiana University. And my youngest son, Brian, had all kinds of airway issues, and we didn't know what was wrong with him. He was born with severe colic, and he couldn't sleep for a year more than 20 minutes. So it was really hard. And I tried everything. I knew that there was something going on. I know it was a very difficult birth. He was a breech. He turned in the canal. And I tried everything from taking him to every doctor I could think of, including like Mayo Clinic and all different places, to try to figure out why he was not able to sleep. He had failure to thrive. They took his tonsils and adenoids out at age 3, which they never did back in those years. But he couldn't breathe, he couldn't sleep, he couldn't eat anything. He had stomach aches constantly. And then it went into headaches constantly. He would wake up with headaches, and I kept taking him to one doctor after another. And then I tried all the traditional and untraditional stuff like acupuncture and chiropractors, and we tried everything, and nothing helped really. And by the time he was 6 or 7, he couldn't go to school because his head hurt so bad. He was real little for his age, and my husband and I were both very tall. And my other son was very tall. And I just was watching my child die, basically. I took him to nutritionists and psychologists and everyone under the sun I could think of, from physical therapy to everyone. And finally, he was diagnosed by a neurologist. They said, perhaps we could do an exploratory brain procedure. And at the time, my husband was transferred to San Diego, California, and I started working in a dental office that did more holistic treatment. He was a TMJ specialist, a jaw specialist. And he said, well, before you do that, let me take a look at him. And I said, sure. And he said, his tongue is in the wrong place. And after that, I was like, what? I never heard of such a thing. He said, the roof of your mouth is the house for the tongue, and his tongue is always down. And I said, well, he breathes through his mouth all the time, but I mean, that's all. I took him to an ENT, an allergist. I took him to all the traditional.
And no one said anything. Yeah.
Well, they said, well, cut out dairy, or but nothing helped really. And they took his tonsils out, but apparently that wasn't enough, because he still couldn't sleep and he still had headaches. And so he said, I just took a class in myofunctional therapy. I'm going to give you some exercises to do for his tongue, to get his tongue working. And I want you to see an osteopathic physician. And there were only 2 in the country back in 1980. And
Mhm.
luckily, one was in San Diego. So I took him to an osteopath. I didn't even know what an osteopath was. A DO, a doctor of
Right.
osteopathy.
Mhm.
And he said, I'm going to make a little bite splint to make his mouth a little wider. Well, I was willing to try anything.
Of course.
Within 3 weeks, his headache stopped.
Mm.
And then he started eating. He would eat 2 meals at a time. We'd go to a restaurant. He'd say, no, I'll eat both meals, Mom. And he would just eat like crazy. And he was sleeping. And then 3 or 4 months later, his teeth started straightening out. He had this real tiny little mouth with crowding. I was like, I have to learn this. I have to learn everything about this. So I went back to school, studied everything in the field at the time. There was an institute in Florida. I went there, then I joined another organization and studied everything. And I started practicing, and then I started teaching courses back in the 1980s. And I've been all over the world, going to universities and trying to educate doctors, but to make a change in our healthcare system is very difficult.
Right.
So I'm happy to be here to share my information. I just finished writing a book. It's called Is Your Tongue Killing You? And that should be ready in about 3 or 4 months, hopefully. I have a lot of co-authors writing it with me. So let me, without further ado, let me share my screen.
Okay.
And I'll show you some slides that I think people would enjoy seeing here. So I'm a speaker with Annenberg, which is a nonprofit. So these are some disclosures, but actually myofunctional therapy has been around since the early 1900s. And it's kind of been pushed under the rug because it did not include orthodontics at that time. There's a lot of politics involved. But these are some of the disorders to look for: the tension around the mouth when you swallow.
I'm not actually seeing the presentation, just so you know, Joy.
Oh, okay. Did you share the screen?
You'll need to do it's at the bottom there. It should say share screen.
Oh, okay. Let me go back. Sorry.
Okay.
Yeah.
Oh, no worries.
Here it is. Okay, now you can probably see all my scribbles here. Not that one. Here we go.
Perfect. Awesome.
So these are some of the disorders to look for: the tension around the mouth when they swallow. And that's because the tongue is coming forward, and in order to stop the food from coming out of your mouth, it's a learned behavior to tense. And the forward head posture, the overdeveloped chin muscle. These are some of the open bites. It could be an anterior or posterior open bite. There's a lot of research now showing that it helps sleep apnea of 50% in adults and 62% in children, which is statistically significant.
Right, that is huge.
The tongue is actually not a muscle. The tongue is an organ, and it's connected with fascial tissue all the way to your feet. So it can affect posture and growth and development.
And I will tell you, the first time I saw this was when I heard you present. I did not know that until I heard you speak.
Really.
Really. And that blows my mind.
So many doctors don't realize it. It's
No.
probably the least diagnosed, most important part of your body. The tongue is actually a respiratory organ. It's not a muscle. It has 16 muscles in it, and it's related to everything from sleep apnea to orthodontic relapse, posture problems, all the way up to learning and behavior issues for children. I know Brian, after his airway was open, he started reading books like crazy. He was just, was amazing to watch the change.
He could focus, yeah.
He could focus. And it also affects nutrition, speech, and pain, whether it be headaches or jaw pain. The muscles of your head and neck are all connected to each other, which it's different from other muscles. There's over 58 muscles in your head and neck that are all connected. And this just shows how, this was a speech pathologist who painted his face so people could understand how the muscles are all connected.
Oh, wow.
Yeah. So these are just some of the muscles of the tongue. I'm not going to go into the anatomy too much, but it's pretty involved. And what is proper oral rest postures? The entire tongue is resting in the palate. And your lips,
It's that back part that I think is so wild.
the back of the tongue is important. The teeth are slightly apart and the hands are away from your face. So everybody thinks they have to clench their teeth together for a proper bite, but it's not that way. The teeth are apart and the tongue is supporting the jaw and the head and neck. And there are doctors now that believe this, that the tongue is a respiratory organ. This is a very famous doctor from Japan. And you can see how it changes the form and function. If you swallow at least 500 to 1,000 times a day with 4 pounds of pressure, which is like 55 grams per centimeter, which is a lot of force. Change the way people swallow, the skull will change. I've seen it over and over again. And posture changes. So, and we can help in many ways in prevention as well as detection. Help with pain. This is just a video from the Mayo Clinic showing.
When you breathe, air travels down your throat, through your windpipe, and into your lungs. The narrowest part of that pathway is in the back of your throat. When you're awake, muscles keep that pathway relatively wide open. But when you sleep, those muscles relax, allowing the opening to narrow. The air passing through this narrowed opening may cause the throat to vibrate. That causes snoring, which many people experience. But in some people, the throat closes so much that enough air can't get through to the lungs. When this happens, the brain sends an alarm to open the airway. Most often, this is associated with a brief arousal from sleep. The brain quickly reactivates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This disorder is called obstructive sleep apnea.
So snoring, it has been like, it has been like discounted, like everybody snores and it's really normal.
Right.
When your child snores, that's danger.
That's an alarm.
They're not getting enough air. And it's something that you need to follow and watch because it's very dangerous. I'm going to go quickly through these. So the open bites can
Mhm.
change. When the tongue is pushing forward, it can change things. It's a combination of form and function working together. And you could see how the tongue may be a natural palate expander. This is hard work. I like working collaboratively with a dentist that understands forward and widthwise growth and can help. But this is possible with just the tongue in a child. So the atypical swallowing is what we deal with. And we see.
And when you say it's possible, once they know where to use the tongue, where to place it, it actually works as a palate expander. It can push the teeth where they're supposed to go.
Yes.
Okay.
No, it's hard work for the patient, for the
Sure.
therapist. A lot of times I personally like to work collaboratively with dentists and physicians. I have a private practice in Pacific Palisades, California, and I work alone, but I do refer when it's necessary. This I did just with exercises. She had an open bite after braces. And here's a bilateral open bite. And gum disease, being a dental hygienist, if the tongue is pushing against the teeth, it can weaken the bone. And also if you're mouth breathing, the bacteria is much more virulent and can cause bone loss. I like this picture because you can really see this is the house for the tongue. And if it's not up there, it collapses. And
it gives it that V shape.
A high narrow palate is definitely one sign of obstructive sleep apnea. I'm gonna show a lot of videos. But here, I really like this because you can see this is a normal tongue rest position. That this pink part is your tongue. And you take a bite and the front part of your tongue pushes against this bone. It's called the premaxilla. It's a real thick bone. And then you swallow the food down. And there's a valve in your throat that says, okay, this is food going down to the stomach. So it closes the valve into the airway. But in an abnormal tongue thrust swallow, and that's what myofunctional therapists treat, the tongue is resting against the teeth, the tongue collapses and air develops, like it gets trapped right here. And then you take a bite of food and your tongue pushes against the teeth and you swallow air. That big clump of air goes down. And so you get this condition called aerophagia, where kids swallow air and they feel bloated after they eat. They're not hungry. And this is what we call peristalsis, which is the movement of food going down. Instead of it going down, it's now confused. And so there's a backwards movement of the food, and that causes acid reflux, what we call GERD. And it can cause a lot of problems. Also, if child is mouth breathing, then they can't smell, they lose their appetite. And so they become picky eaters. And when they're not chewing their food, because if they're mouth breathing, they're not chewing because their brain thinks their mouth is their nose. So they're not chewing their food and they're not getting the digestive enzymes. The parotid gland has all these enzymes that break food down and they're missing it. So they have constant belly aches. And their sense of smell. They can't smell the food, and they don't want to chew anything. So they reach for soft food only. The worst thing you could give your child is the pouches, because they're not getting.
They're not chewing.
They're not chewing anything. And the newborn palate is as soft as a drum, and it can be changed by forces of the tongue. And that's why breastfeeding is so important. If you're breastfeeding properly, this starts talking about tongue ties. If you haven't seen this video, it's only a couple minutes, but it's
Ultrasound of a breastfeeding infant shows just how important the tongue is in obtaining milk from the nipple. Although looking at an ultrasound video may be confusing, let's take a closer look what is going on with the help of an animation. Note that the tongue moves not only back and forth, but also vertically. Without both these motions, which may be constricted by a tongue tie, breastfeeding may become difficult and painful. Anterior tongue tie constricts the tongue motion shown in blue, which is the front part of the tongue. The area shown in red is constricted by a posterior tongue tie, which limits the tongue's vertical motion in the back. When the tongue is effective and painless, breastfeeding occurs.
So I see a lot of children now that are tongue-tied, and adults. They're given a sippy cup with a spout, which is the wrong thing. It's best to just let them drink out of a little cup as soon as they can sit up. But also you want to avoid pacifiers, because that pushes the tongue down. And soft baby food, it teaches the child they don't have to chew anything. So there's this whole movement called baby-led weaning, where the child is going to chew. Of course, I'm very anti-bottle, very anti, artificial infant milk, especially.
What do you recommend for moms that can't be there during the day to feed their children? If they pump, are there certain bottles that are okay to use?
No.
Okay.
It's best the mom to be there, but if it's absolutely impossible, I think the mom should have the baby breastfeed before they leave for work, and then if they can come home for lunch, it's ideal, and then after work to do it, or if they can work at home. I mean, my hat's off to mothers to know what the right thing to do. The right thing to do is to be a stay-at-home mom until the baby doesn't want to breastfeed anymore. But it's hard, in today's world.
Sure. And we want them to breastfeed for at least 2 years, right? That would be ideal.
No, the current thinking is the baby breastfeeds until they don't want it anymore. And it could be as early as 9 months. And it could be as late as 6 or 7 years if they have severe allergies.
Oh, okay. So that's the baby-led weaning. So literally they will guide it based on what they need.
Well, baby-led weaning is more on introducing food.
The food. Okay.
This is breastfeeding information that was given to me by Shelley Marmette, who pioneered and conceptualized the whole field of lactation consulting. She was the one who first said we've got to go back to breastfeeding because we're not doing the right thing by giving up bottles. It's hard to go back because if you're being bottle fed, the baby has an easy time getting the milk out. The baby doesn't have to strain their tongue to go up, but the palate will collapse. baby led weaning, we talked about, it's more for eating, introducing solid foods.
Okay.
This is my grandson. You can see he's 10 years old now, but when he was
Is he
a
like in the
baby,
chops?
he did baby led weaning.
Oh, wow.
You're double fisting there.
No teeth,
Looking
No
good.
teeth, but he's doing it.
Some
but he's
extra
eating meat.
olive oil straight from Italy.
He still likes lamb chops.
Does he?
I have a feeling you like them because I ate them a lot when you were in my belly.
So
Yeah.
this looks good, but a lot of doctors or people are afraid their child is going to choke
Mhm.
on the food, you know. And the truth of the matter is they choke less when they're given the opportunity. As soon as they can sit up, as soon as they have that ability to put something into their mouth. If you start the baby led weaning, then if you wait till their teeth come in when they're 11 or 12 months old, it's too late because they haven't developed the proprioception. That's when they choke more.
Okay.
Start out with just something like a piece of cantaloupe or a banana or something soft, and they get used to moving it around and gumming it enough
Mhm.
so they know not to swallow down the wrong hatch. It's developing that proprioception.
Okay.
But these things are dangerous, and when they first came out, I was livid against them because it's processed food, even if it's organic. It's teaching the child that they don't have to chew anything,
Mhm.
and their teeth will suffer. And is pureed baby food even necessary? It was developed in the 1930s for the war effort. And I know you had Kevin Boyd on here, and it's totally unnecessary to have baby food.
Mhm. And this is one of those times I've mentioned it before, but if a mom is hearing this for the first time, I'll tell them the same thing I said when I heard it from Kevin Boyd. Don't do the guilt. You didn't know. We used to puree and make our own, thinking we were doing such a great thing. We were making it ourselves, so it was healthy. We didn't know.
You don't know what you don't know.
You don't know what you don't know. Mhm.
You do the best you can, but we didn't have blenders. So the baby would just reach over and grab something off our plate in the 1920s, before all this.
Right.
And it's just different. And our skulls, as a result of it, are getting swollen. And we're not eating the right foods. We're eating more processed foods. Children today like pasta. I know, because I have 4 grandkids, and this is what they want to eat. We go out to dinner, pasta, macaroni and cheese,
Mhm.
smoothies,
Nuggets.
has to be chicken nugget, and everything has to be melt in your mouth or they won't eat it.
Mhm.
And so we have to go back to eating real food, meat, fruits, and vegetables. So it's hard because we see a lot of chewing disorders. People don't chew or chew on one side and their face grows funny, and they miss that stimulation, so they're constantly putting things in their mouth, and their muscles are not working right. Yeah. So it can cause jaw problems. I'm going to talk a little bit about sleep position.
Okay.
Which way is correct to sleep? It's best to sleep on your back, not your sides. when you sleep on your sides, you smash your nose. But you have to look at why are people sleeping on their back or not sleeping on their back. And most of it is tongue tie, because if your tongue is restricted, it's going to fall into your airway
Mhm.
on your back. So to get the tongue working will enable the posture to be better.
And
Sometimes,
so the side is not the right way to sleep.
no, because when you're on your side, you're pushing your lower jaw off to one side.
Oh,
Smashing your neck.
okay.
It's best to sleep on your back.
Okay.
If you can't, you can elevate the headboard the size of a brick. But also you want to get your tongue released. Because if you have a tongue tie, and that will also help your neck. If your tongue is restricted, it can't go up, especially the back of the tongue with a posterior tongue tie.
Mhm.
What happens is you choke on food and you'll choke on your tongue. And that's where the snoring and the sleep apnea comes in. So to release the tongue is really, this just shows an anterior
Swallow
tie.
with your lips open. And okay, open.
That's the little
Okay, now I see
string
the-
underneath. But if you see this divot, if you stick your tongue
Mhm.
out, it curls up. That's a posterior tongue tie.
Okay.
Okay, okay. Now can you do a tongue pop? Is that hard?
See it.
Mhm. Okay, can you put your tongue into your cheek? Other cheek?
See how
Mhm.
the lower
Keep
jaw
going.
moves with that.
Mm-hmm.
This is one that had
Sure.
both.
Elevate again. Open the jaw again, open. Okay, it is just, okay, now relax. And now pull, bring it up. Okay,
So the big thing is we have to look at these problems, because if you don't correct it as a baby, as a young child, you'll have the jaw problems and the sleep issues. This is one of our students who took the course to treat herself. This was
Oh,
4 months
wow.
later. You can see how her palate expanded naturally.
And you said 4 months?
4 months of treatment. She wasn't done yet, but you could see how her mandible came forward because her airway.
Mhm.
So
Wow.
speech. A lingual freedom is so important to treat. It's probably the least looked at problem, but it's the most important. I personally had my tongue released when I was in my 50s, and immediately I could sleep better. So
Oh, wow.
just really important.
Why do you think that is something that it's one of the least looked at? Why don't we look at
Well,
it more?
It's mostly because doctors and dentists were not taught that in school, how to do it or why to do it. And so as a result, they're not comfortable. There's a lot of arteries and all kind of muscles and fibers under the
Mhm.
tongue. And so they have to take a continuing education course. Most of the doctors that are doing it have had a child or somebody in their family that benefited. But also it can help your posture. This is 4 months of myofunctional and a tongue release.
That's amazing. Look at his head, how far back that is now.
Yeah.
That's amazing.
Helps your brain work better. This is one of my patients who he had an orthodontic relapse, and when it was finished 1 year, you could see how his teeth changed tremendously and his jaw changed. His
Mhm.
ability to do sports was so much better that he won a scholarship for college. For
Wow.
good school, yeah, complete scholarship. So this just shows a little, one of my patients who his father was pediatrician at UCLA, and he had been diagnosed with Tourette's.
This is Thomas,
He
and
was
Thomas
Tourette's.
is just starting myofunctional therapy
He couldn't
today, which was
control the
November
twitching.
18, 2016.
You
Okay.
notice when he
And
starts
can you tell me,
talking,
Thomas, why you're doing this and what you hope to accomplish?
I'm doing this to to stop my tics and improve and breathe through my nose.
so when he finished.
So this is Thomas, and Thomas is now completely done with myofunctional therapy. And can you tell
He's
everybody
not doing it.
what your
Yeah.
thoughts are about it, how it's helped you?
When I first started, my head was really forward, and my eyes were ticking almost every 3 seconds. And over this time that I've been with Joy, I've really improved. As you can see right now, I'm blinking with both my eyes, not winking anymore.
How's your sleep and all this?
So I used to snore and sleep on my side, and that affected my sleeping and breathing.
Now you're sleeping pretty well.
Yeah.
Sleeping on your back and breathing through your nose all the time too, right?
Yeah.
Can you swivel your chair so we can just take a look at your posture? Wow.
He really improved, but older people will improve too. You can see this lady, how she always looked sad. She had a
Mhm.
eye, and she kept looking better. because
Wow.
it changed the function, yeah. So this is one of our exercises.
On your mark, get set, go.
This is making the lower jaw come down, forward and up. It's working all the face muscles. It's working the tongue.
Okay.
It's almost there. Oh, Megan, Dr. B, neck and neck. Neck and neck.
He's a doctor at the University of Pennsylvania. So these are some of the tools we use. Myomunchie, which allows the child to chew. They like it, feels good. And the Froggy Mouth, which is a great product that actually will enable the back of the tongue to work when it's in there. It's a passive exerciser. It's called Froggy Mouth.
And can adults use Froggy Mouth?
Yeah. Mhm.
Okay. And then what about the tongue gym?
Oh yeah, that's a really neat product that it helps to stretch because it goes under the tongue
Mm-hmm.
and it helps
Okay.
stretch the tongue.
Oh, okay.
Those are some tools that you can do, but the best thing is to, when you're dealing with children,
So, okay, so
the best thing is to teach the child to breathe through their nose. And this breathing re-education or retraining is so critical for children because
Yeah.
it can change so many things. When you breathe through your nose, the air is filtered, it's humidified, it's sterilized, you get more oxygen when you breathe through your nose. And children don't know that. What happens is they go to nursery school and they get hit with all this bacteria and they come home with their first cold and their mouth breathing. And they get better as mommy makes them chicken soup and, you know, all the good things.
Mhm.
But they forgot that their nose is for breathing and that their mouth is for talking and eating. So what a myofunctional therapist, the easiest thing to do is to look at a child when they're like this and say, did you know your nose is for breathing and smelling? And your mouth is for talking and eating. And they right away will close their mouth. I mean, you have to constantly remind them, but after a while, they learn. And it doesn't take that long. There are a lot of little tricks that we do. You know, I call them the 3 Ds. You know, a lot of kids are allergic to dust or they're sensitive to dust. Maybe they've gone to the allergist and they're just sensitive to dust. So you have to teach the mom to get the carpeting out of the bedroom, get covers for the pillows that are dust proof. They're 100% cotton.
Okay.
If the 3 Ds are dust, dairy, do an experiment for 1 month. No dairy. Sometimes that's enough to just break it.
You talking all dairy or just cow milk? All dairy.
All dairy for a
Okay.
month. Just for a month,
Okay.
they can do, you know, oat milk or one of the other milks that are out there. And there's great coconut yogurt, coconut things that you can
Mhm.
taste good. So just for 1 month, try no dairy. And so I said the 3 Ds, dust, dairy, and animals. So if they have cats, dogs, get them out of the bedroom. Even if they're hypoallergic, they carry dust mites. So you want to get the animals out of the bedroom for a while, you know. You have to
Okay.
I tell them, you know, the animals on a farm, they live in the barn, they don't live in your bedroom. So you just have to talk to kids on a kid-friendly level. But then you could do little simple exercises, Buteyko breathing exercises, where you have them hold their nose, keep their lips together,
Mhm.
move their head and count and see how many numbers they can count or how many steps they can take. And then when they have to breathe, they breathe through their nose. And then pretty soon the brain gets it that you have to breathe through your nose. So it's really important that they use their diaphragm too. The diaphragm is the muscle that goes around the waist.
Mhm.
What we do is teach them to breathe with very small breath, but very low, so they're using their diaphragm and slow. And
Do you teach them to put their hands on it so they know where it is?
yeah, or mom can put their hand on the stomach and make my hands move, and you know, you go around the back of them, or have them lay on the couch and put a book on their belly and see if they can see if that book can go up. But you can retrain the breathing. It's really important. That's me at the Mayo Clinic. And, you know, a lot of schools now are trying really hard to, you know, isolate the exercises and make them into, you know, proper. So we work in a team with the patient, with the
Mhm.
and it works. It should be considered the treatment of sleep disorder, breathing malocclusion. What can a parent do? So a parent can find a pediatric dentist for their child that is airway focused. There are quite a few now that are starting to learn how to treat children early.
Okay.
And that's really important. For children. For an older child or an adult, find a myofunctional therapist. I highly recommend it. You'll be light years ahead of the of the medical profession, because the medical profession today is still in the dark ages. I just
Yeah.
listened to a sleep research meeting, PowerPoint presentation, and there wasn't anything on retraining. It was a lot of cognitive behavior things, but nothing to do with breathing, just staying in bed, don't get out of bed and wake up your mom, that kind of like, wait a minute.
Yeah, what is that?
There's a reason why. I know with my son, Brian, when he was little, my friends would say, what's wrong with him? You need to give him a spanking. And I'm like, no, there's something wrong with him. And I want to find out what it is and fix it.
Mhm.
So he has a chance in the world, to learn and play and make friends and
Thrive. Yeah.
Why?
And that goes back to that advocacy thing that we talk about. Can we go back a couple of slides? Because you mentioned something about this the multidisciplinary.
Well, it's
How do we get here? I mean, I know back so long ago, we split off in med school and everybody goes and picks their path. Well, how do we get back? I mean, the DOs are a dying breed. So no one else is looking at it holistically. I know, Virginia Johnson doesn't have a whole lot of students with her. So until we get more DOs, how do we get to this?
well, it's the pediatricians are the ones that have to change, because parents listen to pediatricians.
Mhm.
Pediatricians,
Sure.
first of all, have to recognize tongue tie early.
Okay.
If you recognize it, and when the baby's first born, and you release that tongue, and the mother's breastfeeding, it'll make breastfeeding so much more comfortable and easy to do.
Mhm. Productive, right?
Yeah, it takes so long to breastfeed a baby if they're tied. And maybe the mother gets used to it, but it's not the way Mother Nature wanted it. And I get this question asked all the time: why are there so many tongue ties?
Mhm.
We don't know. We think it's the skulls are getting smaller and the tissue is still there. And I always say, when you live in civilization, you have to use what civilization offers to stay ahead of the problems. And getting your tongue released can make a huge difference. Now, if they're not breastfeeding anymore, you need to do myofunctional therapy, or wait till the child's at least 2.5 to 3, where they can do some exercises.
Okay.
If you cut it when they're 1.5 and they're not breastfeeding anymore, you got a big chance that it's going to scar down. It's going to reattach with scar tissue.
Okay.
And so if you can do it at the first 5 days,
Right.
time. If it's too late for that, then wait till they're 2.5 until they can start doing some exercises that are fun. The kids like
Mhm.
doing myofunctional therapy exercises.
Yeah.
It's hard
do
to
you-
find a good myofunctional therapist. If you go to AOMT, we have a real good training that will enable a speech pathologist or a hygienist or a physical therapist or occupational therapist to get good training. There are some people that teach with the IAOM that have good programs as well. But find somebody if you can. If you can't find anybody, you can find people online to do it.
Mhm.
You know,
Mhm.
I have my own office, and I prefer people to come in person, but if they can't come, I'd say with COVID, I'd say 3/4 of my patients were on Zoom.
Oh, wow.
We did good. We did really well. I stayed open through the whole thing. But
Which is impressive.
a lot of lot of them are telepractice now because it's patients don't want to drive and interact with people anymore.
Well, and it's easier too with kids. It's just easier. You bring them home from school, you could do this and then carry on. And
the good therapist will make it fun and play with the child to make it not feel like a chore, but they can hold things in their mouth while they watch TV. We teach proper chewing.
mhm. So
where they
both
chew on
sides.
both sides and chew it until it's real soft, and then teach them how to gather the bolus and swallow correctly. We also teach them to breathe through their nose and why it's important. You know, it depends on the age of the child. If they're in sports, this will totally improve their sports performance. So a lot of kids will do it for that. A lot of kids are looking at how they look, especially teenagers. They want their lower jaw to come forward. They want definition in their face. They want straight teeth. They want their teeth to be straight or to stay straight, you know. And they want no pain. They want to get rid of their headaches. They want to be able to go to sleep at night without crying for an hour in bed and screaming, I don't want to go to sleep, you know, waking their parents up.
It's heartbreaking.
A family disease.
It is the family disease. It's not just the child.
No,
The repercussions are with everyone.
everyone and other siblings, everyone. And that's how
And
Mark got involved because he saw what happened. Yeah.
And that makes total sense. That makes total sense. And I will definitely put
because Brian had a headache.
and I'll put links to the AOMT and the IOM in our show notes so people can go and check it out. And just, you know, quickly, do you recommend if you have a child, you know, specifically a tongue tie, an older child, obviously, an infant's not going to have this option, but to do myofunctional therapy before and after?
Yeah, you have to, because if you don't do anything before and you just cut it, it's going to reattach. You're not going to get as good a treatment. If you stretch the tongue, get the tongue stretched to the limit and then release it, then you'll be able to get the better result.
Okay, which makes sense.
And then afterwards, you'll do follow-up exercises.
Okay, just to keep it and make sure.
Yeah, we usually
kind of
do
maintenance.
at least a month of therapy first. And then we have specialized post-surgery exercises, and then we go into the regular therapy. The therapy that I do, I would see him weekly for about 3 months, and then other week for a couple of months, and then every 3 weeks, and we slowly titrate over a period of time to make sure that it's habituated. First, we isolate and activate all the muscles of the tongue, and we go into proper chewing and swallowing, even in your sleep, how you swallow. And then we work on posture re-education. Once the tongue is free, you can change the first 3 vertebrae.
Everything, which is amazing to me.
And
once it's done though. You don't have to, you know, these aren't exercises they have to do for the rest of their lives.
No, because you changed the function.
Right. It's just kind of innate at that point.
Right.
So just good. And I know this is it's really an opinion, but you know, we're starting to see, it feels like, I mean, I know this has been a slow motion, you know, this started 10 years ago, but suddenly it feels like this conversation is being moved to the forefront, and we're having more conversations about breathing and airway and sleep, especially when it comes to children. Where do you think we're going to be as far as medicine in the next 5 to 10 years?
Well, we have the science now, and we're getting more and more and more science. The problem is it takes a doctor 10 years to accept anything new coming along. They have to hear it again and again. They have to see it at their conventions. They have to read it in their journals. They have to have a child that has that problem themselves, and then they start owning it. You know,
Okay.
like one doctor at a time is gonna, but I see eventually myofunctional therapy will be its own program. Right now, it's postgraduate training for speech pathologists, dental hygienists, physical therapists, occupational therapists, doctors, dentists, you know, chiropractors. But it needs to be its own program, and it needs to encompass everything, you know, the pulmonology and the dentistry, and it needs to be involved in everything. And
It's kind of on that DO track. That's where it needs to be.
Its own profession, and maybe a master's program. But that takes time. It takes time to implement a new type of therapy, because we're dealing with the insurance companies, we're dealing with you know, a lot of resistance, because people are making a lot of money with pharmaceuticals and making a lot of money with surgeries and making a lot
Attractive
of
braces.
money.
Yeah.
Not that braces are bad, but you want to get the function and the structure working together at the same time.
Before you put on retractive braces and we pull it all back and just compound the issue.
Yeah, you don't want to extract permanent teeth. The ideal is to have all 32 of your teeth, even the wisdom teeth, to have the arches develop. And eventually they're going to find ways to do that for everyone.
Hopefully. Let's hope so.
We're going to be in a flux, a big change because of sleep disorders. Sleep disorders affect so many people. You know, car accidents and all of that. So we need to really up the ante here.
Agreed. So at the end of every episode, I am in the habit of, I mean, I know we just did this amazing presentation, but just to hand it back so that you have the last word to leave with parents. So maybe whatever we haven't covered, or just what you think is just the critical, important piece to leave them with.
That the old-fashioned way was the best, you know, as far as breastfeeding and letting a baby eat off of your plate. And it's changed. Even if your child is 17 years old, there's still hope, because it's worse now than it ever was. And I think a lot of it is you're adding computers and cell phones and texting and heavy backpacks that weigh 60 pounds on their back, and they're texting while they walk. And you know, the assaults are different now, when processed foods and chemicals and artificial meat, and you know, to eat real food is best, and to value sleep and try to support sleep habits that are good. Breathing is key to everything. Eating real food. Of course, breastfeeding when you have baby, as long as possible. If you have a problem with breastfeeding, it's generally a tongue tie. And there are help with lactation consultants out there and people that are doing baby myo all over to help prevent problems. Prevention is the key, really.
It's key. Prevention is key. It is.
If we can catch it early, prevent it, and then, you know, support other people, other mothers, to get the right treatment for their children as well.
That's huge. Well, I cannot thank you enough for coming on and sharing. I mean, at least I would imagine other parents will think the same thing, but it was like just this little mini master class in Myo, and I appreciate it. Thank you so much, Joy.
My my website,
Mhm.
joymoeller.com. Okay, I'd be happy to answer any questions for you.
Absolutely. I will put that on there. Thank you.
Thank you.